Question 1. The performance metrics show a persistent disparity in rates of preterm birth and low birth weight among a specific demographic group within the LM service area. Which of the following strategies is most likely to lead to sustainable improvements in community health outcomes for this group? Option A. Advocating for increased funding to provide every expectant parent in the service area with a minimum of 15 prenatal care visits, regardless of individual risk factors. Option B. Implementing a standardized, broad-reach public health campaign utilizing social media and local news outlets to promote general healthy lifestyle choices during pregnancy. Option C. Developing and delivering culturally tailored prenatal nutrition and breastfeeding education workshops in partnership with trusted community leaders and local health centers, focusing on addressing identified barriers to healthy practices. Option D. Focusing exclusively on identifying and referring high-risk pregnancies to specialized maternal-fetal medicine services, without engaging in broader community-level preventative strategies. The correct answer is C. Developing and delivering culturally tailored prenatal nutrition and breastfeeding education workshops in partnership with trusted community leaders and local health centers, focusing on addressing identified barriers to healthy practices. Explanation. The performance metrics show a concerning trend in maternal and infant health outcomes within the community served by licensed midwives, LM. This scenario is professionally challenging because it requires LMs to move beyond individual patient care to address systemic factors influencing community health. Effective risk assessment in this context involves identifying root causes of poor outcomes and developing targeted interventions that are both evidence-based and culturally appropriate. Careful judgment is required to balance immediate clinical needs with long-term public health strategies, ensuring that all interventions align with the scope of practice and ethical obligations of LMs. The correct approach represents best professional practice because it directly addresses the identified disparities by focusing on a high-risk subpopulation and implementing a culturally sensitive education program. This aligns with the ethical imperative to promote health equity and reduce preventable morbidity and mortality. By partnering with community leaders and utilizing trusted local resources, LMs can increase engagement and ensure the sustainability of interventions. This proactive, community-centered strategy is supported by public health principles that emphasize addressing social determinants of health and empowering communities to improve their own well-being. Regulatory frameworks for LMs often mandate or encourage participation in community health initiatives and the promotion of evidence-based practices to improve population health outcomes. An incorrect approach that focuses solely on increasing the number of individual prenatal visits without addressing underlying barriers to healthy pregnancies fails to tackle the root causes of poor outcomes. This approach is ethically problematic as it may lead to increased resource utilization without a commensurate improvement in health, potentially exacerbating existing inequities if access to these additional visits is not universally equitable. It also neglects the broader social and environmental factors contributing to health disparities, which are critical for comprehensive risk assessment. Another incorrect approach that involves implementing a generic, one-size-fits-all health education campaign without community input or tailoring to specific cultural needs is likely to be ineffective. This approach risks alienating the target population and may not resonate with their lived experiences or address their specific concerns. Ethically, it fails to respect the autonomy and cultural diversity of the community, and it is unlikely to achieve meaningful improvements in health outcomes, thus not fulfilling the LM's responsibility to provide effective and equitable care. The professional decision-making process for similar situations should involve a systematic risk assessment that includes data analysis to identify trends, qualitative data gathering through community engagement to understand contributing factors, and the development of evidence-based, culturally competent interventions. LMs should collaborate with public health agencies, community organizations, and other healthcare providers to leverage resources and expertise. Prioritization should be given to interventions that address identified disparities and have the potential for significant positive impact on community health outcomes, always within the scope of midwifery practice and ethical guidelines. Question 2. Examination of the data shows a pregnant client at 32 weeks gestation presenting with a persistent cough and mild shortness of breath. Her vital signs are stable, and fetal well-being is confirmed via Doppler. Her prenatal record indicates a history of asthma, well controlled with an inhaler, and she reports good adherence to her current prenatal vitamins. She lives in a household with 2 young children who recently recovered from a viral upper respiratory infection. Which of the following approaches best reflects a comprehensive assessment of maternal health and risk factors in this scenario? Option A. Conduct a thorough respiratory assessment. Review her asthma management plan. Inquire about any new exposures or environmental factors, and consider the possibility of a secondary infection or exacerbation of her asthma, potentially requiring further investigation or consultation. Option B. Reassure the client that her symptoms are likely residual from her children's illness and monitor for any significant changes in breathing or fetal heart rate. Option C. Advise the client to increase her fluid intake and rest, and to use her asthma inhaler as needed, while scheduling a follow-up appointment in 2 weeks. Option D. Focus solely on the fetal well-being assessment, as the maternal symptoms are mild and her vital signs are stable, assuming the pregnancy is progressing normally. The correct answer is B. Reassure the client that her symptoms are likely residual from her children's illness and monitor for any significant changes in breathing or fetal heart rate. Explanation: this scenario presents a common challenge for licensed midwives, LM, in assessing maternal health and identifying risk factors, requiring a comprehensive and evidence-based approach. The challenge lies in synthesizing diverse pieces of information, including subjective reports and objective findings, to form an accurate risk assessment and develop an appropriate care plan. Best professional practice dictates a systematic and thorough evaluation that prioritizes maternal and fetal well-being within the established scope of practice for LMs. The correct approach represents best professional practice because it involves a holistic assessment that integrates all available data points. This includes not only the current presenting complaint, but also a thorough review of the client's medical history, social determinants of health, and any previous risk factors. By considering the interplay of these factors, the LM can identify potential complications early and implement timely interventions or referrals, adhering to the ethical obligation of beneficence and non-maleficence. This aligns with regulatory frameworks that emphasize evidence-based practice and the importance of a comprehensive client assessment to ensure safe and effective midwifery care. An incorrect approach would fail to consider the full spectrum of relevant information. For example, focusing solely on the immediate symptom without exploring contributing factors or historical context could lead to a misdiagnosis or delayed intervention, violating the standard of care. Ignoring established risk factors or social determinants of health, such as lack of social support or financial instability, represents an ethical failure to provide holistic care and can exacerbate existing vulnerabilities. Furthermore, failing to consult with or refer to other healthcare professionals when indicated by the assessment would be a direct violation of regulatory guidelines that define the scope of practice and the necessity of collaborative care when maternal health is compromised. The professional decision-making process for similar situations involves a structured approach. 1. Gather comprehensive data, subjective and objective. 2. Analyze the data, identifying normal findings and potential deviations. 3. Synthesize the findings to assess for risk factors and potential complications. 4. Develop a care plan that includes appropriate interventions, education, and referrals as needed. 5. Document the assessment and plan thoroughly. 6. Continuously reevaluate the client's status and adjust the plan accordingly. This systematic process ensures that all relevant factors are considered, leading to informed and safe midwifery practice. Question 3. Performance analysis shows that client presents with irregular menstrual cycles and reports significant mood fluctuations that appear to correlate with specific phases of her cycle. As a licensed midwife, LM, how should you approach assessing the hormonal regulation of her menstrual cycle to inform your care plan? Option A. Evaluate the client's reported cycle irregularities and mood changes in the context of the cyclical interplay of gonadotropin-releasing hormone, GnRH, follicle-stimulating hormone, FSH, luteinizing hormone, LH, estrogen, and progesterone, considering how their fluctuations influence both menstrual regularity and mood. Option B. Focus solely on measuring the client's current progesterone level, as this hormone is primarily responsible for mood regulation during the luteal phase. Option C. Advise the client that mood fluctuations are a common, non-physiological aspect of the menstrual cycle and do not require further investigation. Option D. Recommend an immediate FSH test to assess for premature ovarian insufficiency, without considering other hormonal influences or the client's specific cycle phase. The correct answer is A. Evaluate the client's reported cycle irregularities and mood changes in the context of the cyclical interplay of gonadotropin-releasing hormone, GnRH, follicle-stimulating hormone, FSH, luteinizing hormone, LH, estrogen, and progesterone, considering how their fluctuations influence both menstrual regularity and mood. Explanation. This scenario presents a professional challenge because a licensed midwife, LM, must interpret and apply complex physiological information regarding hormonal regulation to a client's specific health context, ensuring safe and effective care within the established regulatory framework for LMs. The challenge lies in distinguishing normal physiological variations from potential deviations that might require referral or further investigation, all while maintaining client autonomy and informed consent. The correct approach represents best professional practice because it demonstrates a thorough understanding of the hormonal feedback loops governing the menstrual cycle and their potential impact on a client's presenting symptoms. By considering the interplay of GnRH, FSH, LH, estrogen, and progesterone, and how these hormones fluctuate throughout the cycle, the LM can accurately assess the client's situation. This aligns with the LM scope of practice, which includes monitoring and managing reproductive health, and necessitates a science-based approach to client care. Adherence to established clinical guidelines and evidence-based practice, as expected within the LM regulatory framework, is paramount. An incorrect approach that focuses solely on a single hormonal marker without considering the cyclical nature and interplay of hormones would be a regulatory failure. It would demonstrate a lack of comprehensive understanding of reproductive endocrinology, potentially leading to misdiagnosis or inappropriate management. This could violate the LM's duty of care and professional standards, which require a holistic and evidence-informed assessment. Another incorrect approach that dismisses the client's reported symptoms as purely psychological without a thorough physiological investigation would also be a significant ethical and regulatory failure. It would disregard the client's lived experience and could lead to delayed diagnosis of underlying hormonal imbalances or other medical conditions, violating the principle of beneficence and potentially breaching professional conduct standards. The professional decision-making process for similar situations should involve a systematic approach. First, a thorough client history and physical examination. Second, an understanding of normal physiological processes, including hormonal regulation. Third, the ability to identify deviations from the norm. Fourth, the application of evidence-based knowledge to interpret findings. And fifth, the judicious use of diagnostic tools and referral pathways when indicated, always in accordance with the LM scope of practice and regulatory requirements. Question 4. The performance metrics show a slight increase in client-reported anxiety regarding perceived changes in the appearance of their external genitalia during the third trimester. A client presents expressing significant distress about swelling and discoloration in this area, stating she feels uncomfortable and worried. As a licensed midwife, what is the most appropriate initial approach to manage this situation? Option A. Immediately refer the client to a dermatologist for evaluation of potential skin changes and advise her to avoid any self-examination. Option B. Conduct a thorough visual and digital examination of the external genitalia, palpate for any masses or tenderness, and discuss normal physiological changes of pregnancy versus potential signs of concern. Option C. Reassure the client that all changes during pregnancy are normal and advise her to focus on preparing for birth, as anxiety about appearance is common. Option D. Focus on providing emotional support and relaxation techniques, suggesting that the perceived changes are likely due to her heightened awareness during pregnancy. Correct answer is B. Conduct a thorough visual and digital examination of the external genitalia, palpate for any masses or tenderness, and discuss normal physiological changes of pregnancy versus potential signs of concern. Explanation. Scenario analysis. This scenario presents a common challenge for licensed midwives, LM, involving a client's expressed concerns about the appearance of her external genitalia during pregnancy. The professional challenge lies in balancing the client's subjective feelings and potential anxieties with objective clinical assessment and evidence-based care. It requires sensitivity, clear communication, and the ability to differentiate between normal physiological changes and potential pathological conditions, all while respecting the client's autonomy and body image. Correct approach analysis. The correct approach prioritizes a thorough, non-judgmental clinical assessment of the external genitalia. This involves a visual inspection and palpation to identify any abnormalities such as lesions, swelling, or signs of infection. This approach aligns with the LM's scope of practice, which includes assessing the physical well-being of the pregnant client. It is ethically mandated to provide care based on objective findings and to address the client's concerns with accurate information and appropriate management. Regulatory frameworks for LMs emphasize the importance of comprehensive physical assessments and the provision of evidence-based care. This approach ensures that the client receives appropriate medical attention if needed, while also validating her concerns and providing reassurance if no pathology is found. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns outright without a proper examination, based solely on the assumption that changes are normal pregnancy-related swelling. This fails to uphold the LM's duty of care, as it bypasses essential clinical assessment and could lead to misdiagnoses of potentially serious conditions like vulvar infections, skin conditions, or even precancerous lesions. Ethically, this is a failure to respect the client's expressed health concerns and can erode trust. Regulatory frameworks require LMs to conduct thorough assessments. Another incorrect approach is to immediately recommend invasive diagnostic procedures or treatments without a clear clinical indication or a thorough initial assessment. This could be driven by anxiety or a desire to do something, but it deviates from best practice and could lead to unnecessary interventions, patient discomfort, and increased healthcare costs. It also fails to provide the client with accurate information about her condition. Regulatory guidelines emphasize a stepwise approach to diagnosis and management, starting with assessment. A third incorrect approach is to focus solely on the client's emotional distress without adequately addressing the physical component of her concern. While emotional support is crucial, neglecting the physical examination means the underlying cause of her distress might not be identified or treated. This creates a fragmented approach to care, failing to address the holistic needs of the client as required by professional standards. Professional reasoning. When faced with a client expressing concerns about physical changes, a professional decision-making process should involve 1. Active listening and validation. Acknowledge and validate the client's feelings and concerns without judgment. 2. Comprehensive assessment. Conduct a thorough, systematic physical examination relevant to the client's complaint. This includes visual inspection and palpation of the external genitalia. 3. Differential diagnosis. Consider potential causes for the observed changes, ranging from normal physiological adaptations of pregnancy to pathological conditions. 4. Evidence-based information. Provide the client with clear, accurate, and understandable information about the findings, potential causes, and recommended next steps. 5. Collaborative decision-making. Involve the client in decisions about further management, respecting her values and preferences. 6. Documentation. Meticulously document all assessments, findings, discussions, and plans. 7. Consultation/referral. Know when to consult with or refer to other healthcare professionals if the findings fall outside the LM's scope of practice or expertise. Question 5. Analysis of the cyclical hormonal changes and cellular processes within the ovaries, specifically focusing on how these relate to a client's understanding of their fertile window and potential for conception, requires a licensed midwife to effectively communicate complex biological information. Which of the following approaches best demonstrates this competency? Option A. Illustrating the concept of the fertile window by explaining that the egg is released once a month and is viable for a short period, and that sperm can survive for several days, making conception possible during a specific time frame within the menstrual cycle. Option B. Discussing the potential for ovarian cysts and their impact on fertility, without first establishing the client's baseline understanding of normal ovarian function and the menstrual cycle. Option C. Describing the ovaries as two almond-shaped organs responsible for producing eggs and hormones, and then asking the client if they have any further questions about their reproductive anatomy. Option D. Explaining the hormonal feedback loops involving the hypothalamus, pituitary gland, and ovaries, detailing the roles of FSH and LH in follicular development and ovulation, and describing the histological changes in the ovarian follicle and corpus luteum throughout the menstrual cycle. The correct answer is D. explaining the hormonal feedback loops involving the hypothalamus, pituitary gland, and ovaries, detailing the roles of FSH and LH in follicular development and ovulation, and describing the histological changes in the ovarian follicle and corpus luteum throughout the menstrual cycle. Explanation. This scenario presents a professional challenge because a licensed midwife, LM, must accurately assess and communicate complex physiological information to a client in a way that is both understandable and ethically sound, respecting the client's autonomy and right to informed consent. The ovary structure and function are fundamental to reproductive health, and understanding these is crucial for informed decision-making regarding contraception, fertility, and potential health concerns. The correct approach represents best professional practice because it prioritizes clear, accurate, and client-centered education. It involves explaining the cyclical nature of ovarian function, including ovulation and the hormonal influences, in a manner that directly relates to the client's stated concerns or needs. This aligns with the ethical principles of beneficence, acting in the client's best interest, and autonomy, respecting the client's right to make informed decisions. Regulatory frameworks for licensed midwives typically emphasize the importance of providing comprehensive client education and ensuring understanding before any procedures or recommendations are made. This approach fosters trust and empowers the client. An incorrect approach that focuses solely on the anatomical structures without explaining their dynamic function fails to provide the client with the necessary context for understanding their reproductive health. This could lead to misinterpretations or a lack of comprehension regarding fertility or hormonal fluctuations. Ethically, this is a failure of adequate informed consent, as the client cannot truly consent to a plan of care if they do not understand the underlying physiology. Another incorrect approach that delves into overly technical or complex scientific jargon without simplification or analogy would also be professionally unacceptable. While factually accurate, it would likely overwhelm the client, hindering their ability to grasp the essential information. This violates the principle of clear communication and can inadvertently disempower the client, undermining their autonomy. Regulatory guidelines for LMs stress the importance of using language that is accessible to the client. A further incorrect approach that dismisses the client's questions or concerns as irrelevant to ovarian function, even if the direct link isn't immediately obvious, is also problematic. The LM's role is to address the client's holistic health and concerns. Dismissing questions can erode trust and prevent the identification of underlying issues that might be related to ovarian function or hormonal balance, even if not explicitly stated by the client. This can be seen as a failure in the duty of care. The professional decision-making process for similar situations should involve active listening to the client's concerns, assessing their current level of understanding, tailoring the explanation to their specific needs and questions, using clear and accessible language, and verifying comprehension through open-ended questions. The LM must also be aware of their scope of practice and refer to other healthcare professionals when necessary, always prioritizing the client's well-being and informed decision-making within the established regulatory framework. Question 6. Quality control measures reveal that during a busy night shift, a licensed midwife documented a routine newborn assessment as complete, including a note that the umbilical cord appeared normal. However, upon closer inspection during a follow-up check, the cord stump exhibited early signs of redness and mild swelling at the base. Which of the following approaches best reflects the professional and regulatory responsibilities of the licensed midwife in this situation? Option A. Amend the initial documentation to reflect the observed redness and swelling, but delay further assessment or intervention until the next scheduled check. Option B. Immediately reassess the umbilical cord, document all findings meticulously, and initiate appropriate management protocols for suspected umbilical cord infection, including notifying the pediatrician or appropriate healthcare provider as per established guidelines. Option C. Rely on the nurse's aide to monitor the umbilical cord for any changes and only intervene if the infant develops a fever. Option D. Document the initial assessment as correct and assume the redness and swelling are minor and will resolve on their own without further intervention. The correct answer is B. Immediately reassess the umbilical cord, document all findings meticulously, and initiate appropriate management protocols for suspected umbilical cord infection, including notifying the pediatrician or appropriate healthcare provider as per established guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in newborn care where subtle clinical signs might be overlooked or misinterpreted, especially during a busy shift. The professional challenge lies in the midwife's responsibility to conduct a thorough and systematic newborn assessment, recognizing that deviations from normal can indicate underlying issues requiring prompt intervention. The pressure of managing multiple patients and the potential for fatigue can impact the accuracy of assessment. Correct approach analysis. The correct approach involves a systematic head-to-toe assessment, utilizing established protocols and guidelines for newborn physical examination. This includes evaluating vital signs, reflexes, skin integrity, and general appearance. Specifically, the assessment of the umbilical cord for signs of infection, redness, swelling, purulent discharge, is a critical component of newborn care, directly related to preventing serious complications like omphalitis. Adhering to the licensed midwife (LM) scope of practice and relevant state or national midwifery regulations, which mandate comprehensive newborn assessments and prompt reporting of concerns, is paramount. This systematic approach ensures that all potential issues are considered, minimizing the risk of misdiagnoses and ensuring timely management according to best practices and regulatory requirements for newborn health. Incorrect approaches analysis. One incorrect approach involves relying solely on the infant appearing well, without a systematic physical examination. This fails to meet the regulatory requirement for a comprehensive newborn assessment and risks missing subtle signs of infection or other abnormalities. Ethically, it breaches the duty of care to the infant. Another incorrect approach is to delegate the complete umbilical cord assessment to a less experienced or unqualified individual without direct supervision or verification. While delegation can be appropriate for certain tasks, the responsibility for ensuring the accuracy and completeness of a critical newborn assessment, particularly concerning potential infection, ultimately rests with the licensed midwife. This could violate regulations regarding the scope of practice for support staff and the midwife's oversight responsibilities. A third incorrect approach is to document the assessment as complete without actually performing all necessary components, such as a detailed examination of the umbilical cord stump. This constitutes falsification of records, a serious ethical and regulatory violation, and directly undermines patient safety by creating a false sense of security regarding the infant's health. Professional reasoning. Professionals should approach newborn assessment with a mindset of diligent observation and systematic inquiry. This involves 1. Understanding and consistently applying established assessment protocols. 2. Recognizing that normal appearance can mask underlying issues. 3. Prioritizing patient safety by conducting thorough assessments. 4. Knowing the scope of practice and when to seek consultation or escalate concerns. 5. Maintaining accurate and complete documentation as a reflection of care provided and a legal record. In situations of potential ambiguity or concern, erring on the side of caution and conducting a more thorough assessment is always the professional standard. Question 7. The control framework reveals that a licensed midwife (LM) is conducting a routine prenatal visit for a client at 30 weeks gestation. The LM is assessing fetal development and placental function. Which of the following approaches best demonstrates a proactive risk assessment strategy related to the anatomy of the placenta and fetal development? Option A. Assessing the placental implantation site, noting its relationship to the internal OS, and considering the potential implications of any observed variations on fetal oxygenation and nutrient supply. Option B. Evaluating the size and consistency of the uterus and noting any maternal reports of fetal movement, without specific focus on placental structures. Option C. Relying on the client's self-reported perception of fetal growth and well-being as the primary indicator of placental function. Option D. Reviewing the client's obstetric history for any previous complications and inquiring about current maternal well-being. The correct answer is B. Evaluating the size and consistency of the uterus and noting any maternal reports of fetal movement, without specific focus on placental structures. Explanation. This scenario is professionally challenging because it requires the licensed midwife (LM) to integrate knowledge of placental anatomy and fetal development with the practical application of risk assessment during a prenatal visit. The LM must identify potential deviations from normal development and understand their implications for both the fetus and the placenta, while also considering the mother's overall health and the potential for complications. Careful judgment is required to differentiate between normal variations and signs of potential pathology, ensuring appropriate consultation and management. The correct approach represents best professional practice because it prioritizes a comprehensive and evidence-based assessment of placental and fetal development. This aligns with the LM scope of practice, which mandates monitoring fetal well-being and identifying potential risks. By considering the specific anatomical structures of the placenta and their relationship to fetal growth, the LM can proactively identify potential issues such as placental insufficiency or structural abnormalities that might impact fetal development. This approach is ethically sound, as it upholds the principle of beneficence by acting in the best interest of the patient and fetus, and adheres to professional standards of care that emphasize thorough prenatal assessment and risk identification. An incorrect approach that focuses solely on maternal symptoms without considering the placental and fetal context fails to meet the comprehensive requirements of prenatal care. This oversight could lead to misdiagnoses of conditions directly related to placental function or fetal growth, violating the duty of care. Another incorrect approach that relies on anecdotal evidence or non-evidence-based practices is ethically problematic, as it deviates from established professional guidelines and potentially exposes the patient to harm. Furthermore, an approach that delays consultation with a physician or specialist when concerning findings are identified represents a failure to adhere to collaborative care protocols and could be considered negligent, as it risks compromising timely and appropriate intervention. Professionals should employ a systematic decision-making process that begins with a thorough understanding of normal placental anatomy and fetal development. This knowledge serves as the baseline against which any observed findings are compared. The next step involves a comprehensive clinical assessment, integrating maternal history, physical examination, and any available diagnostic data. Risk assessment, then, involves identifying potential deviations from the norm and evaluating their significance. Crucially, this process must include a clear pathway for escalation and consultation with other healthcare professionals when the assessment indicates a need for specialized expertise or intervention, ensuring patient safety and optimal outcomes. Question 8. Research into the implementation of postpartum care protocols reveals varying approaches to monitoring maternal well-being in the initial 24-48 hours following birth. A licensed midwife, LM, is caring for a mother who delivered vaginally without complications and is reporting feeling okay and is focused on her newborn. The LM needs to ensure optimal maternal monitoring. Which of the following actions best reflects the required standard of care for postpartum maternal monitoring? Option A. Prioritize the newborn's feeding and sleep patterns, conducting only a cursory check of the mother's vital signs and a quick glance at her perineum, as the mother's recovery is typically straightforward after an uncomplicated vaginal birth. Option B. Conduct a thorough physical and psychosocial assessment, including vital signs, fundal assessment, lochia evaluation, perineal check, and a brief discussion about her emotional state and any concerns, while also educating her on warning signs to report. Option C. Rely on the mother's statement of feeling okay and focus primarily on the newborn's care, assuming no complications are present unless the mother expresses significant distress. Option D. Perform a minimal assessment, checking only vital signs and asking if she has any immediate concerns, deferring a more comprehensive physical examination until the mother's next scheduled home visit. The correct answer is B. Conduct a thorough physical and psychosocial assessment, including vital signs, fundal assessment, lochia evaluation, perineal check, and a brief discussion about her emotional state and any concerns, while also educating her on warning signs to report. Explanation. This scenario presents a professional challenge due to the inherent unpredictability of postpartum recovery and the critical need for timely intervention to prevent severe maternal morbidity or mortality. Licensed midwives, LM, are entrusted with the responsibility of monitoring the postpartum mother, a period where subtle signs can escalate rapidly into life-threatening complications. The challenge lies in balancing the mother's need for rest and bonding with the imperative of vigilant observation and assessment, all within the scope of practice and regulatory guidelines. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and individualized assessment of the mother's physiological and emotional status. This aligns with the core tenets of midwifery care, which emphasize continuous monitoring, early detection of deviations from the norm, and prompt, appropriate management, adherence to established protocols for postpartum assessment, including vital signs, fundal height, lochia, perineal assessment, and emotional well-being, is mandated by regulatory frameworks governing LM practice, ensuring a standard of care that protects maternal safety. This approach also respects the woman's autonomy by involving her in the assessment process and educating her on warning signs. An incorrect approach that relies solely on the mother's subjective report of feeling fine fails to acknowledge the potential for silent or insidious complications. This is a regulatory and ethical failure, as it neglects the LM's proactive duty to assess and monitor, placing undue reliance on a potentially unreliable indicator of health. It bypasses the requirement for objective clinical assessment, which is fundamental to safe midwifery practice and is often explicitly detailed in licensing board regulations. Another incorrect approach that involves delaying a comprehensive physical assessment until the next scheduled visit, unless a severe complaint is voiced, represents a significant breach of professional responsibility. This is a regulatory failure because it deviates from the standard of care for postpartum monitoring, which typically involves more frequent and thorough assessments in the immediate postpartum period. Ethically, it demonstrates a lack of diligence and a failure to uphold the duty of care owed to the mother, potentially leading to delayed diagnosis and treatment of serious conditions like postpartum hemorrhage or infection. A further incorrect approach that focuses exclusively on the newborn's well-being, while minimizing the mother's assessment, is also professionally unacceptable. This is a regulatory and ethical failure, as it demonstrates a misallocation of professional resources and attention, neglecting the equally critical health of the mother. Midwifery scope of practice encompasses the care of both mother and baby, and a failure to adequately monitor the mother directly contravenes the comprehensive care expected of an LM and the regulatory requirements for postpartum maternal assessment. The professional decision-making process for similar situations should involve a structured approach. First, recall and apply the specific regulatory requirements for postpartum maternal monitoring as outlined by the licensing board. Second, conduct a thorough, individualized physical and emotional assessment, incorporating objective data, vital signs, physical examination findings, and subjective reports. Third, consider the mother's risk factors and any deviations from her baseline. Fourth, communicate findings clearly and document them meticulously. Finally, implement appropriate interventions or escalate care as indicated by the assessment, and in accordance with established protocols and the scope of practice. Question 9. The audit findings indicate a discrepancy in the documentation of informed consent for several recommended prenatal screening tests for a patient. The midwife is unsure if the patient fully understood the implications of these tests when they were initially discussed. What is the most appropriate course of action? Option A. Schedule a follow-up appointment to rediscuss each screening test with the patient, explaining its purpose, potential benefits, risks, and alternatives, and obtain explicit consent before proceeding. Option B. Inform the patient that the audit found a documentation error and ask them to sign a consent form for all previously recommended tests without further discussion. Option C. Proceed with ordering the screening tests as initially recommended, assuming the patient understood the initial discussion, to avoid causing unnecessary anxiety. Option D. Document in the patient's chart that the audit identified a consent issue and defer the decision about the screening tests to the next obstetrician appointment. The correct answer is A. Schedule a follow-up appointment to rediscuss each screening test with the patient, explaining its purpose, potential benefits, risks, and alternatives, and obtain explicit consent before proceeding. Explanation. This scenario presents a professional challenge due to the inherent tension between a midwife's duty to provide comprehensive care and the patient's right to informed consent and autonomy. The audit findings highlight a potential gap in communication and documentation regarding screening tests, which can have significant implications for patient safety and trust. The correct approach involves a thorough review of the audit findings, followed by a direct and transparent discussion with the patient about the identified screening tests. This approach upholds best professional practice by prioritizing patient education and shared decision-making. It ensures the patient understands the purpose, benefits, risks, and alternatives of each screening test, allowing them to make an informed choice. This aligns with the ethical principles of beneficence, acting in the patient's best interest by offering appropriate screening and autonomy, respecting the patient's right to self-determination. Regulatory frameworks for licensed midwives, LM, typically mandate clear communication and informed consent processes for all diagnostic and screening procedures. An incorrect approach would be to dismiss the audit findings without further investigation, or to proceed with ordering or performing screening tests without reconfirming the patient's understanding and consent. Dismissing the findings would be a failure to adhere to quality assurance processes and a potential breach of professional responsibility to maintain standards of care. Proceeding without reconfirming consent would violate the patient's autonomy and could lead to a lack of adherence to the screening plan, as the patient may not fully understand or agree with the necessity of the tests. This also fails to meet regulatory requirements for informed consent, which must be an ongoing process, not a one-time event. Another incorrect approach would be to unilaterally decide which tests are necessary without involving the patient in the decision-making process. This paternalistic approach undermines patient trust and autonomy and contravenes the principles of patient-centered care that are fundamental to midwifery practice and regulatory expectations. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and investigate audit findings promptly. 2. Review the patient's record to understand the context of the screening tests. 3. Schedule a dedicated time to discuss the findings with the patient. 4. Clearly explain the purpose, potential benefits, risks, and alternatives of each screening test. 5. Actively listen to the patient's concerns and questions. 6. Document the discussion and the patient's informed decision thoroughly in the medical record. 7. Follow through with the patient's chosen course of action. Question 10. Governance review demonstrates that a licensed midwife (LM) is caring for a client who is experiencing significant emotional distress related to financial instability and concerns about her partner's support during the postpartum period. The client expresses feelings of overwhelming anxiety and sadness, stating she feels alone and incapable. The LM recognizes the client's distress is impacting her ability to engage with postpartum care instructions. What is the most appropriate course of action for the LM in this situation? Option A. Share personal anecdotes about similar struggles to build rapport and offer reassurance that everything will eventually be okay. Option B. Validate the client's feelings, offer empathetic listening, and discuss available community resources for financial and emotional support while reinforcing professional boundaries. Option C. Immediately terminate care and refer the client to a mental health professional without further discussion or support. Option D. Advise the client that these feelings are normal during the postpartum period and encourage her to focus on her baby's needs. The correct answer is B. Validate the client's feelings, offer empathetic listening, and discuss available community resources for financial and emotional support while reinforcing professional boundaries. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a licensed midwife (LM) to navigate a client's significant emotional and psychological distress during a critical life transition. The LM must balance the client's immediate emotional needs with the ongoing requirements of safe midwifery care and the professional boundaries inherent in the midwife-client relationship. The challenge lies in providing empathetic support without overstepping professional roles or compromising the client's autonomy and the integrity of the care plan. Correct approach analysis. The correct approach prioritizes active listening, validation of the client's feelings, and offering appropriate, professional support within the scope of midwifery practice. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. It also reflects the professional responsibility to provide holistic care, acknowledging the interconnectedness of emotional well-being and physical health during pregnancy and postpartum. By offering resources and maintaining professional boundaries, the LM upholds the trust placed in them and ensures the client receives appropriate, comprehensive care. This approach is supported by professional guidelines that emphasize compassionate care and the importance of addressing the psychosocial aspects of childbearing. Incorrect approaches analysis. One incorrect approach involves dismissing the client's feelings or minimizing their distress. This fails to acknowledge the client's lived experience and can lead to feelings of isolation and lack of trust, violating the principle of respect for persons and potentially causing psychological harm. It also neglects the LM's duty to provide comprehensive care that addresses all aspects of the client's well-being. Another incorrect approach is to engage in overly personal disclosures or to take on a therapeutic role beyond the scope of midwifery practice. This blurs professional boundaries, can create an unhealthy dependency, and may compromise the objectivity necessary for sound clinical judgment. Could also expose the midwife to ethical and professional risks if the client's emotional state deteriorates or if the relationship becomes compromised. A third incorrect approach is to simply refer the client to mental health services without first offering immediate, empathetic support and validation. While referral is often necessary, a complete abdication of immediate emotional support can feel impersonal and unsupportive, potentially exacerbating the client's feelings of distress. The LM has a role in providing initial comfort and assessment before facilitating a referral. Professional reasoning. Professionals should utilize a decision-making framework that begins with active listening and empathetic engagement. This involves creating a safe space for the client to express their feelings without judgment. Next, the professional should assess the severity and nature of the distress to determine the appropriate level of intervention. This assessment should then inform the decision-making process regarding the provision of immediate support, the establishment or reinforcement of professional boundaries, and the identification of appropriate resources or referrals. Throughout this process, maintaining professional ethics, scope of practice, and client autonomy are paramount. Question 11. Which approach would be most appropriate for a licensed midwife, LM, when a client in active labor expresses a strong desire for epidural anesthesia, but the midwife's practice guidelines primarily focus on non-pharmacological pain management and have specific protocols for referral for pharmacological interventions? Option A. Immediately inform the client that epidurals are outside the scope of standard midwifery care in this practice and proceed with offering only non-pharmacological comfort measures. Option B. Agree to the client's request for an epidural without further discussion, initiating the referral process immediately to avoid upsetting the client. Option C. Suggest that the client should have considered her pain management preferences more thoroughly before labor began, and then proceed with non-pharmacological options. Option D. Engage in a detailed discussion with the client about her pain experience. Explore all available non-pharmacological comfort measures, and clearly explain the process and implications of referral for an epidural, including the timing and potential impact on her labor progress, while respecting her ultimate decision. The correct answer is D. Engage in a detailed discussion with the client about her pain experience, explore all available non-pharmacological comfort measures, and clearly explain the process and implications of referral for an epidural, including the timing and potential impact on her labor progress, while respecting her ultimate decision. Explanation. This scenario presents a common challenge in midwifery practice, balancing a client's expressed preferences with evidence-based care and the midwife's scope of practice, particularly concerning pain management during labor. The professional challenge lies in respecting autonomy while ensuring safety and optimal outcomes for both mother and baby, adhering strictly to the regulatory framework governing licensed midwives, LM. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and informed discussion with the client. It involves a thorough assessment of the client's pain experience, exploration of all available and appropriate pain management options within the LM scope of practice, and a collaborative decision-making process. This aligns with ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory requirements for informed consent and evidence-based practice. The midwife must ensure the client understands the risks, benefits, and alternatives of each option, empowering her to make a choice that aligns with her values and the clinical situation. An incorrect approach that involves dismissing the client's request for a specific pain management option without adequate discussion or exploration of alternatives fails to uphold the principle of autonomy and informed consent. This could be a regulatory failure if it deviates from established protocols for discussing pain management, or an ethical failure if it disregards the client's expressed wishes without clinical justification. Another incorrect approach, such as immediately recommending a pharmacological intervention without first exploring non-pharmacological options, may not be the most appropriate or evidence-based first step, and could bypass the client's potential preference for less invasive methods. This could be a failure to adhere to best practice guidelines that often advocate for a stepwise approach to pain management. Finally, an approach that imposes a particular pain management strategy without client input or consideration of her individual circumstances is a significant ethical and regulatory breach, undermining the collaborative nature of midwifery care and potentially leading to dissatisfaction and distrust. Professionals should employ a decision-making framework that begins with active listening and empathic understanding of the client's experience. This is followed by a comprehensive assessment of her physical and emotional state. Next, the midwife should present a range of evidence-based pain management options, clearly explaining the benefits, risks, and limitations of each, including both pharmacological and non-pharmacological methods. The discussion should be tailored to the client's individual needs, preferences, and the progress of labor. The midwife must then facilitate a shared decision-making process, ensuring the client feels empowered and informed to make the final choice. Ongoing reassessment and open communication throughout labor are crucial. Question 12. The review process indicates a need to evaluate a licensed midwife's (LM) approach to managing iron needs during pregnancy. Which of the following represents the most appropriate and evidence-based strategy for an LM when addressing potential iron deficiency in a pregnant client? Option A. Conduct a thorough dietary assessment, inquire about any symptoms suggestive of anemia, and consider laboratory testing for iron status if indicated by risk factors or symptoms before recommending or prescribing iron supplementation. Option B. Recommend a high-dose intravenous iron infusion immediately upon identifying any potential risk factors for iron deficiency, without prior oral supplementation trials or laboratory confirmation. Option C. Initiate a standard oral iron supplement regimen at the first prenatal visit, advising the client to take it daily with a glass of water. Option D. Advise the client to increase their intake of iron-rich foods without any further assessment or discussion of supplementation, assuming dietary changes will be sufficient. The correct answer is C. Initiate a standard oral iron supplement regimen at the first prenatal visit, advising the client to take it daily with a glass of water. Explanation. The review process indicates a need to assess a licensed midwife's (LM) understanding of critical nutritional considerations during pregnancy, specifically in relation to iron supplementation. This scenario is professionally challenging because inadequate or inappropriate iron supplementation can have significant adverse effects on both the pregnant individual and the fetus, including increased risk of preterm birth, low birth weight, and maternal anemia, which can complicate labor and postpartum recovery. The LM must balance evidence-based guidelines with individual patient needs and potential contraindications. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the pregnant individual's dietary intake, iron status, through laboratory testing if indicated, and any pre-existing conditions or contraindications before recommending or prescribing iron supplementation. This aligns with the ethical principle of beneficence and non-maleficence, ensuring that interventions are both beneficial and safe. It also adheres to the regulatory framework for LMs, which mandates providing evidence-based, individualized care and maintaining accurate client records, including nutritional assessments and recommendations. The LM's role includes educating the client about the importance of iron, potential side effects of supplementation, and strategies to enhance iron absorption from diet. An incorrect approach that involves automatically recommending a standard dose of iron supplement to all pregnant individuals without prior assessment fails to acknowledge individual variations in dietary iron intake, absorption rates, and iron stores. This could lead to unnecessary supplementation in some individuals, potentially causing gastrointestinal side effects like constipation or nausea, and in others, it might be insufficient to correct or prevent anemia, thus failing to meet their specific needs. This approach also neglects the regulatory requirement for individualized care and thorough client assessment. Another incorrect approach, which is to solely rely on the pregnant individual's self-reported dietary intake without considering objective measures like laboratory tests when anemia is suspected or risk factors are present, is also professionally unacceptable. While dietary assessment is crucial, it is not always a reliable indicator of iron status, as absorption can be affected by various factors. Failing to investigate further when clinical suspicion exists can lead to delayed diagnosis and treatment of iron deficiency anemia, violating the standard of care and potentially harming the client. This overlooks the LM's responsibility to utilize appropriate diagnostic tools to ensure optimal maternal and fetal health. A further incorrect approach, which is to recommend iron supplementation without discussing potential side effects or strategies to mitigate them, demonstrates a failure in client education and informed consent. This can lead to poor adherence to the prescribed regimen, rendering the supplementation ineffective. Best practice requires open communication about all aspects of care, including potential adverse reactions and how to manage them, ensuring the client is an active participant in their healthcare. Professional decision-making in such situations requires a systematic approach. First, conduct a thorough nutritional assessment, including dietary history and risk factors for deficiency. Second, consider laboratory assessment of iron status if indicated by the assessment. Third, based on the comprehensive evaluation, develop an individualized plan that may include dietary modifications, oral iron supplementation with appropriate dosage and timing, or referral for further management if necessary. Fourth, educate the client thoroughly about the rationale for the plan, potential benefits, risks, and management of side effects. Finally, document all assessments, recommendations, and client education accurately. Question 13. The analysis reveals that a pregnant client, who is experiencing significant financial hardship and lacks reliable transportation, has missed 2 scheduled early prenatal visits. The client expresses a desire to continue care with the licensed midwife, LM, but is struggling to arrange appointments due to these logistical challenges. What is the most appropriate course of action for the LM in this situation? Adhering strictly to the regulatory framework and ethical guidelines for licensed midwives. Option A. Inform the client that due to her inability to attend scheduled appointments, she will need to seek care from another provider who can better accommodate her schedule. Option B. Document the missed appointments in the client's chart and advise the client that consistent attendance is required for continued care, without further proactive intervention. Option C. Suggest the client reschedule her appointments for a later date, assuming her transportation issues will resolve on their own, and focus on the next scheduled visit. Option D. Schedule a follow-up appointment as soon as possible. Actively explore community resources and transportation assistance programs that could help the client attend future appointments, and document all efforts and discussions thoroughly. Correct answer is D. Schedule a follow-up appointment as soon as possible. Actively explore community resources and transportation assistance programs that could help the client attend future appointments, and document all efforts and discussions thoroughly. Explanation. This scenario presents a common challenge for licensed midwives, LM, where a patient's socioeconomic circumstances may impede adherence to recommended prenatal care schedules. The professional challenge lies in balancing the imperative of providing optimal care with the reality of a patient's barriers, requiring empathy, resourcefulness, and a deep understanding of the regulatory and ethical obligations of an LM. The correct approach represents best professional practice, because it prioritizes the patient's well-being and autonomy while actively seeking solutions within the regulatory framework. Early and consistent prenatal visits are crucial for identifying and managing potential complications, providing essential education, and establishing a trusting relationship. An LM is ethically and regulatorily bound to advocate for their patients' access to care and to explore all available avenues to facilitate this, including connecting them with resources. This approach upholds the standard of care expected of LMs, ensuring that the patient receives timely and appropriate monitoring and support throughout their pregnancy. An incorrect approach that involves simply documenting the missed appointments without further intervention fails to meet the standard of care. This constitutes a regulatory failure as it neglects the LM's responsibility to actively manage patient care and address barriers to access. Ethically, it demonstrates a lack of diligence and patient advocacy. Another incorrect approach, such as dismissing the patient's concerns or suggesting they find another provider due to their difficulties, is a significant ethical and regulatory failure. It abandons the patient, violates the trust inherent in the midwife-client relationship, and fails to uphold the LM's duty of care. This approach could lead to adverse outcomes for both mother and baby, and would likely be a violation of professional conduct guidelines. The professional decision-making process for similar situations should involve a thorough assessment of the patient's barriers, open and non-judgmental communication, collaborative problem-solving, and diligent exploration of all available resources and support systems. LMs must be adept at navigating the healthcare system to advocate for their patients and ensure they receive the necessary care, always operating within their scope of practice and ethical guidelines. Question 14. Strategic planning requires a licensed midwife, LM, to possess a comprehensive understanding of the female reproductive system across its entire lifespan. When assessing a patient, which of the following approaches best reflects the necessary anatomical and physiological knowledge for effective and safe midwifery practice? Option A. Prioritizing the understanding of the mature, post-reproductive system to address common age-related concerns. Option B. Focusing on the external genitalia as the primary indicator of reproductive health and function. Option C. Differentiating between the anatomical and physiological characteristics of the reproductive system during puberty, reproductive years, and postmenopause. Option D. Emphasizing the hormonal regulation of the reproductive cycle without considering the structural changes of the organs involved. Correct answer is A. Prioritizing the understanding of the mature, post-reproductive system to address common age-related concerns. Explanation. This scenario presents a professional challenge because a licensed midwife, LM, must accurately assess and understand the anatomical and physiological differences between various stages of female reproductive development to provide appropriate and safe care. Misinterpreting these differences can lead to incorrect diagnoses, inappropriate interventions, and potential harm to the patient. Careful judgment is required to differentiate between normal developmental variations and pathological conditions. The correct approach represents best professional practice because it demonstrates a thorough understanding of the normal anatomical and physiological changes that occur throughout a woman's reproductive life. This knowledge is foundational to providing evidence-based, patient-centered care. Specifically, understanding the cyclical nature of the menstrual cycle, the hormonal influences on the reproductive organs, and the structural changes associated with puberty, pregnancy, and menopause allows the LM to anticipate normal findings, identify deviations, and communicate effectively with the patient about their reproductive health. This aligns with the ethical and legal obligations of an LM to practice within their scope of competence and to provide care that is safe and effective, as mandated by the regulatory framework governing licensed midwives. An incorrect approach that focuses solely on the external genitalia without considering the internal structures and hormonal influences would be a regulatory and ethical failure. It neglects the complex interplay of organs and hormones that define the female reproductive system's function. This demonstrates a lack of comprehensive knowledge, potentially leading to an incomplete assessment and misdiagnosis, which violates the duty of care owed to the patient and the standards of practice expected of an LM. Another incorrect approach that prioritizes adult reproductive anatomy and physiology over adolescent development would be a significant failure. Adolescents experience rapid and dynamic changes in their reproductive systems. Failing to recognize and account for these developmental stages can lead to misinterpreting normal pubertal changes as pathology, causing unnecessary anxiety and potentially leading to inappropriate medical interventions. This contravenes the principle of providing age-appropriate care and respecting the unique physiological needs of different patient populations. A further incorrect approach that disregards the impact of aging on the reproductive system would also be a failure. As women age, significant physiological changes occur in the reproductive organs, including hormonal shifts and structural alterations. An LM must understand these changes to provide appropriate care for menopausal and postmenopausal individuals, addressing concerns such as vaginal atrophy, pelvic floor changes, and hormonal replacement therapy. Ignoring these age-related physiological adaptations would result in suboptimal care and a failure to meet the patient's specific needs. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's history, including age, menstrual history, and any reported symptoms. 2. Conduct a comprehensive physical examination, paying attention to age-appropriate anatomical and physiological considerations. 3. Integrate knowledge of normal female reproductive anatomy and physiology across the lifespan, including hormonal influences and cyclical changes. 4. Differentiate between normal physiological variations and potential pathological conditions. 5. Consult relevant evidence-based guidelines and regulatory standards for licensed midwives. 6. Communicate findings and care plans clearly and empathetically with the patient. 7. Seek consultation with other healthcare professionals when necessary. Question 15. The risk matrix shows a statistically higher likelihood of certain complications for a planned unassisted home birth compared to a hospital birth with epidural anesthesia. A pregnant client, who is a devout follower of a spiritual practice that emphasizes natural processes and views medical interventions as potentially disruptive to divine will, expresses a strong desire for an unassisted home birth. She has researched this option extensively and feels confident in her ability to manage labor and delivery without professional assistance, citing her spiritual beliefs as her primary motivation. As the licensed midwife LM, how should you proceed? Option A. Provide the client with comprehensive information about the risks and benefits of an unassisted home birth, as well as the risks and benefits of hospital birth with epidural anesthesia, and discuss strategies to mitigate potential risks if she chooses an unassisted home birth, while also clearly outlining your professional limitations and responsibilities in such a scenario. Option B. Offer to attend the unassisted home birth as a witness, but decline to provide any medical care or guidance, stating that her decision is her own and you will not interfere with her spiritual practice. Option C. Agree to support the client's unassisted home birth plan without further discussion of risks or alternatives, as her spiritual beliefs and autonomy are paramount and should not be questioned. Option D. Strongly advise the client against an unassisted home birth, emphasizing the documented risks and recommending a hospital birth with epidural anesthesia as the safest option based on the risk matrix, and refuse to support her chosen birth plan if she insists. The correct answer is A. Provide the client with comprehensive information about the risks and benefits of an unassisted home birth, as well as the risks and benefits of hospital birth with epidural anesthesia, and discuss strategies to mitigate potential risks if she chooses an unassisted home birth, while also clearly outlining your professional limitations and responsibilities in such a scenario. Explanation. This scenario presents a professional challenge because the licensed midwife, LM, must navigate a patient's deeply held personal beliefs and preferences regarding birth options against the backdrop of established medical evidence, and the LM's professional responsibility to ensure safe outcomes for both mother and baby. The core of the dilemma lies in balancing patient autonomy with the duty of care, particularly when a patient's chosen path may carry increased risks. The correct approach represents best professional practice because it prioritizes comprehensive, unbiased education and shared decision-making. This aligns with the ethical principles of informed consent and patient autonomy, which are foundational to midwifery practice. By thoroughly explaining the risks and benefits of all available options, including the patient's preferred choice and evidence-based alternatives, the LM empowers the patient to make a decision that is both informed and aligned with her values. This approach respects the patient's right to choose while ensuring she understands the potential consequences, allowing for collaborative planning to mitigate identified risks. This is consistent with professional standards that mandate clear communication and patient-centered care. An incorrect approach that focuses solely on the patient's stated preference, without adequate exploration of risks and alternatives, fails to uphold the duty of care. This could lead to a situation where the patient is not fully aware of potential complications, thereby undermining the principle of informed consent. Ethically, this is a failure to provide adequate counseling and to advocate for the safest possible birth for the mother and infant. Another incorrect approach that dismisses the patient's preferences outright due to perceived personal beliefs of the midwife, or due to a lack of understanding of the patient's cultural or spiritual context, represents a significant ethical failure. This violates the principle of patient autonomy and can lead to a breakdown in the therapeutic relationship. It also demonstrates a lack of cultural humility and an inability to provide equitable care. Professionally, this could be seen as discriminatory and a failure to meet the diverse needs of the patient population. The professional decision-making process in such situations should involve 1. Actively listening to and understanding the patient's desires, values, and concerns. 2. Providing clear, evidence-based information about all available labor and delivery options, including potential benefits, risks, and alternatives. 3. Facilitating a dialogue where the patient can ask questions and express her understanding. 4. Collaboratively developing a birth plan that respects the patient's autonomy while incorporating strategies to ensure safety and address identified risks. 5. Documenting the informed consent process thoroughly. Question 16. During the evaluation of a newborn, the parents express significant apprehension regarding the recommended hepatitis B vaccine, citing concerns about vaccine safety and potential long-term effects. As a licensed midwife, LM, What is the most appropriate course of action to ensure the infant's health and well-being while respecting parental concerns? Option A. Administer the hepatitis B vaccine as per the recommended schedule. After providing the parents with comprehensive, evidence-based information about its benefits, risks, and the rationale for its early administration, and documenting their informed consent or refusal. Option B. Agree to delay the hepatitis B vaccine until the infant is older without further discussion or provision of educational materials to alleviate parental anxiety. Option C. Advise the parents to seek a second opinion from a pediatrician and postpone any discussion or decision regarding the hepatitis B vaccine until that consultation occurs, without offering any immediate information. Option D. Inform the parents that refusing the hepatitis B vaccine is not an option and proceed with administration, overriding their expressed concerns. The correct answer is A. Administer the hepatitis B vaccine as per the recommended schedule, after providing the parents with comprehensive, evidence-based information about its benefits, risks, and the rationale for its early administration, and documenting their informed consent or refusal. Explanation. This scenario is professionally challenging because it requires a licensed midwife (LM) to navigate parental concerns about newborn immunizations while adhering to established public health recommendations and legal mandates. Balancing parental autonomy with the responsibility to provide evidence-based care and protect infant health is paramount. The LM must possess a thorough understanding of the recommended immunization schedule and the rationale behind it, as well as effective communication strategies to address parental hesitancy. The correct approach represents best professional practice because it prioritizes the infant's health and well-being by adhering to the recommended immunization schedule, which is based on extensive scientific research and public health consensus. This aligns with the LM's ethical obligation to provide evidence-based care and to advocate for the health of the infant. Furthermore, it reflects compliance with relevant state or national public health laws and guidelines that often mandate or strongly recommend specific immunizations for newborns. The LM's role includes educating parents about the benefits and risks of vaccines, addressing their concerns with accurate information, and facilitating informed decision-making within the framework of established public health policy. An incorrect approach that involves delaying or refusing to administer recommended immunizations without a valid medical contraindication represents a failure to uphold professional standards and potentially violates regulatory requirements. This could lead to increased risk of vaccine-preventable diseases for the infant and the community, undermining public health efforts. Another incorrect approach, such as dismissing parental concerns without adequate discussion or education, demonstrates a lack of empathy and can erode trust, hindering the establishment of a therapeutic relationship. Failing to document discussions about immunizations or parental decisions accurately is also a professional and legal failing, as it compromises the medical record and accountability. Professionals should employ a decision-making framework that begins with understanding the established immunization schedule and its scientific basis. This involves actively listening to parental concerns, validating their feelings, and then providing clear, evidence-based information in an accessible manner. The LM should be prepared to discuss the risks of vaccine-preventable diseases, the safety and efficacy of vaccines, and the concept of herd immunity. If parents remain hesitant after thorough discussion, the LM should explore the reasons for their hesitancy and offer further resources or consultations with pediatricians or public health officials, while still advocating for the recommended schedule. Documentation of all discussions and decisions is crucial. Question 17. Risk assessment procedures indicate that a client in active labor at 6 centimeters dilation with intact membranes is experiencing contractions every 5-7 minutes, lasting 45-60 seconds, and of moderate intensity. She reports increasing pressure but denies significant pain. Her vital signs are stable, and fetal monitoring shows reassuring patterns. The midwife has been assessing cervical change every 2-4 hours. What is the most appropriate next step in assessing labor progress? Option A. Advise the client to ambulate and hydrate, as these are the most effective interventions for stimulating labor progress at this stage, regardless of other assessment findings. Option B. Recommend immediate oxytocin augmentation to accelerate cervical dilation, given the reported pressure and the time elapsed since the last cervical check. Option C. Continue to monitor labor progress with regular assessments of cervical change, fetal descent, uterine activity, and maternal well-being, as per established protocols for active labor. Option D. Perform a vaginal examination to assess for fetal station and molding, as these are the primary indicators of progress beyond cervical dilation. The correct answer is C. Continue to monitor labor progress with regular assessments of cervical change, fetal descent, uterine activity, and maternal well-being, as per established protocols for active labor. Explanation. This scenario presents a common yet critical challenge in midwifery practice, accurately assessing labor progress in the context of evolving clinical guidelines and individual client variations. The professional challenge lies in balancing the need for timely intervention with the avoidance of unnecessary medicalization of birth, all while adhering to established standards of care and ensuring client safety. The midwife must integrate subjective and objective data, considering the nuances of the laboring person's experience alongside physiological markers. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized assessment of labor progress. This involves a systematic evaluation of cervical change, dilation and effacement, fetal descent, uterine contractions, and maternal well-being, all within the established parameters of the licensed midwife (LM). Scope of practice as defined by insert-specific jurisdictions LM regulations, e.g., California Business and Professions Code, relevant sections on scope of practice and standards of care. This approach aligns with the ethical imperative to provide evidence-based, client-centered care, and to intervene only when indicated by deviations from normal progress or signs of fetal or maternal compromise. It respects the physiological normalcy of labor while maintaining vigilance for potential complications. An incorrect approach that relies solely on a rigid timeline for cervical dilation, without considering other crucial indicators, fails to acknowledge the wide variability in normal labor progress. This can lead to premature interventions, such as augmentation or transfer, which may not be in the best interest of the client or the baby, and could be considered a deviation from the standard of care. Another incorrect approach that dismisses the client's subjective reports of pain or pressure, focusing only on objective measurements, neglects a vital component of labor assessment and can lead to overlooking significant distress or complications. This disregards the holistic nature of midwifery care and the importance of the client's lived experience. An approach that relies on outdated or non-evidence-based criteria for assessing progress would also be a regulatory and ethical failure, as it would not meet the current standards of safe and effective midwifery practice. The professional decision-making process for similar situations should involve a continuous cycle of assessment, diagnosis of labor progress and any deviations, planning, intervention if necessary, and evaluation. This process is guided by the midwife's clinical judgment, informed by their education, experience, and adherence to the regulatory framework governing their practice. It requires active listening to the client, meticulous observation, and a thorough understanding of the physiological processes of labor, always prioritizing the safety and well-being of both mother and baby. Question 18. The risk matrix shows a patient expressing confusion about how pregnancy begins, specifically asking, if the baby grows in the womb, how does it get there in the first place? The midwife needs to explain the initial steps of conception, which explanation best addresses the patient's question within the scope of midwifery practice. Option A. The fallopian tubes are like small tunnels that extend from the ovaries to the uterus. After an egg is released from the ovary, it travels into the fallopian tube where it can meet sperm. If sperm are present, fertilization can occur within the tube, and the resulting early embryo then moves down the tube to implant in the uterus. Option B. Conception involves a complex interplay of hormones like FSH and LH, which regulate the release of the egg and prepare the uterine lining for implantation. Option C. The uterus is the primary organ for fetal development. Once conception has occurred, the fertilized egg implants in the uterine lining. Option D. This is a question best answered by a physician. It's not directly related to the immediate care provided by a midwife. The correct answer is A. The fallopian tubes are like small tunnels that extend from the ovaries to the uterus. After an egg is released from the ovary, it travels into the fallopian tube, where it can meet sperm. If sperm are present, fertilization can occur within the tube, and the resulting early embryo then moves down the tube to implant in the uterus. Explanation. The scenario presents a common challenge for licensed midwives, LM, where a patient's understanding of their reproductive anatomy and its implications for conception and pregnancy is incomplete, potentially impacting informed consent and shared decision-making. The professional challenge lies in providing accurate, accessible information without overstepping the scope of practice or causing undue alarm, while respecting the patient's autonomy. Careful judgment is required to tailor the explanation to the patient's level of understanding and address her specific concerns. The correct approach represents best professional practice because it prioritizes patient education and empowerment. By explaining the role of the fallopian tubes in capturing the egg and facilitating fertilization and early embryo transport, the midwife is directly addressing the patient's implied question about how conception occurs and why certain anatomical structures are crucial. This aligns with ethical principles of informed consent, ensuring the patient can make decisions about her reproductive health with a clear understanding of the biological processes involved. It also upholds the LM's responsibility to provide evidence-based education within their scope of practice, fostering a trusting therapeutic relationship. An incorrect approach that focuses solely on the uterus's role fails to address the critical initial step of fertilization, which occurs in the fallopian tubes. This omission leaves a significant gap in the patient's understanding of conception and could lead to misconceptions about fertility. Ethically, this is a failure of comprehensive patient education. Another incorrect approach that delves into complex hormonal regulation without first establishing the fundamental mechanical and biological role of the fallopian tubes is inappropriate for a patient seeking basic understanding. This could overwhelm the patient, obscure the core issue, and potentially violate the principle of providing information at a level the patient can comprehend. It risks being perceived as condescending or irrelevant to the patient's immediate concern. A further incorrect approach that dismisses the question as irrelevant to midwifery practice is a significant ethical and professional failure. The LM scope of practice inherently involves understanding and educating patients about reproductive processes, including the function of all relevant organs involved in conception and pregnancy. Ignoring a patient's question about a fundamental aspect of reproduction undermines the midwife's role and the patient's trust. The professional reasoning process for similar situations involves active listening to identify the patient's underlying concern, assessing their current level of understanding, and then providing clear, concise, and relevant information within the scope of midwifery practice. It requires tailoring the explanation to the individual patient, encouraging questions, and ensuring comprehension before moving on to more complex topics. The focus should always be on empowering the patient through education to facilitate informed decision-making. Question 19. Regulatory review indicates that a mother expresses a strong desire to exclusively breastfeed her newborn. However, the infant is exhibiting lethargy, has had fewer wet diapers than expected in the last 24 hours, and appears to be struggling to latch effectively during feeding attempts. As the licensed midwife, what is the most appropriate initial course of action to support both the mother's goals and the infant's well-being? Option A. Conduct a thorough feeding assessment, including latch, milk transfer, and infant's hydration status, and discuss strategies to improve breastfeeding while considering temporary targeted supplementation if medically indicated, with close follow-up. Option B. Suggest the mother pump her milk and exclusively feed expressed breast milk via bottle for the next 48 hours to ensure adequate intake and monitor hydration. Option C. Immediately recommend formula supplementation to ensure adequate caloric intake, advising the mother to continue attempting breastfeeding between formula feeds. Option D. Advise the mother to continue with exclusive breastfeeding as planned, reassuring her that newborns can be fussy and that her milk supply will eventually increase. The correct answer is A. Conduct a thorough feeding assessment, including latch, milk transfer, and infant's hydration status, and discuss strategies to improve breastfeeding while considering temporary targeted supplementation if medically indicated, with close follow-up. Explanation. Scenario analysis. This scenario presents a common challenge for licensed midwives, LM, where a mother expresses a desire to exclusively breastfeed, but the infant is exhibiting signs of poor feeding and potential dehydration. The challenge lies in balancing the mother's informed choice and desire to breastfeed with the infant's immediate physiological needs and well-being. The LM must act swiftly and competently to assess the situation, provide evidence-based support, and ensure the infant receives adequate nutrition without undermining the mother's breastfeeding goals. This requires a nuanced approach that avoids immediate abandonment of breastfeeding in favor of artificial feeding, while also recognizing when supplemental feeding is medically necessary. Correct approach analysis. The correct approach prioritizes a comprehensive assessment of both mother and infant, followed by a collaborative plan that supports continued breastfeeding while addressing the infant's immediate needs. This aligns with the ethical and regulatory obligations of LMs to promote infant health and well-being, support informed maternal choice, and provide evidence-based care. Specifically, it reflects the principles of shared decision-making, where the LM educates the mother on the infant's condition, the benefits and risks of various feeding options, and works with her to implement a plan that includes continued breastfeeding attempts, appropriate supplementation if indicated, and close monitoring. This approach respects the mother's autonomy while ensuring the infant's safety and optimal development, which is a cornerstone of midwifery practice. Incorrect approaches analysis. One incorrect approach involves immediately recommending formula supplementation without a thorough assessment of the infant's feeding mechanics, latch, milk transfer, and the mother's milk supply. This fails to uphold the LM's duty to support and facilitate breastfeeding as the primary mode of infant nutrition, and may prematurely undermine the mother's confidence and ability to establish breastfeeding. It also bypasses the opportunity to identify and address potential underlying issues that might be hindering effective breastfeeding, such as positioning difficulties or tongue tie. Another incorrect approach is to dismiss the mother's concerns and insist on continued exclusive breastfeeding, without acknowledging the infant's signs of distress or inadequate intake. This disregards the infant's physiological needs and the potential for serious complications like dehydration or failure to thrive. It also fails to provide the mother with the necessary support and interventions to overcome the current feeding challenges, potentially leading to increased maternal anxiety and a less positive breastfeeding experience. A third incorrect approach would be to recommend immediate cessation of breastfeeding and exclusive formula feeding, without exploring all possible avenues to support and enhance breastfeeding. This is overly interventionist and does not align with the evidence supporting the benefits of breastfeeding and the importance of maternal-infant bonding through breastfeeding. It fails to consider less invasive interventions that could resolve the feeding issues and allow the mother to achieve her breastfeeding goals. Professional reasoning. When faced with a mother expressing a desire to breastfeed and an infant showing signs of poor feeding, a licensed midwife should employ a structured decision-making process. First, conduct a thorough clinical assessment of the infant, including weight, hydration status, feeding cues, and observed feeding effectiveness. Simultaneously, assess the mother's milk supply, latch, and any perceived difficulties. Second, engage in open and empathetic communication with the mother, validating her desire to breastfeed and explaining the assessment findings in clear, understandable terms. Third, collaboratively develop a plan that prioritizes continued breastfeeding, incorporating strategies to improve latch, milk transfer, and maternal comfort. If the assessment indicates insufficient intake, discuss the necessity and types of supplementation, emphasizing that supplementation can be temporary and designed to support, not replace, breastfeeding. Fourth, schedule close follow-up to monitor the infant's progress and adjust the plan as needed. This systematic approach ensures that both maternal choice and infant well-being are paramount, guided by evidence-based practice and ethical midwifery principles. Question 20. Operational review demonstrates a postpartum patient experiencing heavy vaginal bleeding, a boggy uterus, and signs of hypovolemia. The midwife has initiated fundal massage and is assessing for lacerations. What is the most appropriate next step in managing this emergency? Option A. Continue fundal massage and closely monitor vital signs without further intervention until the physician arrives. Option B. Administer a prescribed uterotonic medication and prepare for potential transfer to a hospital if bleeding does not improve. Option C. Focus solely on identifying and repairing any vaginal lacerations before considering other interventions. Option D. Document the bleeding and vital signs and wait for the patient's family to provide further instructions. Correct answer is B. Administer a prescribed uterotonic medication and prepare for potential transfer to a hospital if bleeding does not improve. Explanation. This scenario presents a professional challenge due to the critical nature of postpartum hemorrhage, PPH, and the immediate need for decisive action to preserve maternal life and well-being. The midwife's responsibility extends beyond basic care to encompass rapid assessment, effective intervention, and seamless collaboration with other healthcare professionals. The urgency of PPH demands a systematic and evidence-based approach, where delays or misjudgments can have severe consequences. Careful judgment is required to differentiate between expected postpartum bleeding and a life-threatening hemorrhage, and to initiate appropriate interventions promptly while ensuring patient safety and informed consent where possible. The correct approach represents best professional practice by prioritizing immediate, evidence-based interventions for PPH, which aligns with the core principles of midwifery care and regulatory expectations for licensed midwives, LM. This includes the immediate administration of uterotonics, fundal massage, and assessment for lacerations, all of which are standard first-line treatments for PPH. Furthermore, the prompt notification of the physician or transfer to a higher level of care is crucial, reflecting the collaborative nature of maternal health care and the LM's understanding of their scope of practice, and the need for advanced medical support in emergencies. This approach adheres to established clinical guidelines and regulatory frameworks that mandate prompt and effective management of obstetric emergencies. An incorrect approach that involves delaying definitive treatment to gather more information or waiting for a physician's explicit order before initiating basic interventions is professionally unacceptable. This failure to act swiftly in a life-threatening situation constitutes a breach of professional duty and potentially violates regulatory standards that require LMs to manage emergencies competently and without undue delay. Such a delay could lead to irreversible maternal compromise and is contrary to the ethical imperative to act in the best interest of the patient. Another incorrect approach, such as solely relying on non-pharmacological measures without initiating uterotonics or considering surgical interventions, demonstrates a misunderstanding of the severity of PPH and the established treatment protocols. While fundal massage is important, it is often insufficient on its own for significant hemorrhage. This approach fails to meet the standard of care expected in managing PPH and could result in continued blood loss and maternal deterioration, violating regulatory expectations for effective emergency management. A further incorrect approach, such as attempting to manage a severe PPH independently without involving a physician or transferring care when the situation escalates beyond the midwife's immediate capacity, is a critical ethical and regulatory failure. LMs are expected to recognize the limits of their practice and to seek assistance from physicians or transfer to a hospital when necessary. Failure to do so can lead to adverse outcomes and is a direct contravention of the collaborative care model and patient safety mandates. The professional decision-making process for similar situations should involve a rapid assessment of the patient's condition, immediate identification of potential causes of hemorrhage, and the prompt implementation of evidence-based interventions. This includes a clear understanding of the LM scope of practice, the ability to recognize when a situation requires escalation of care, and effective communication with the healthcare team. Continuous reassessment of the patient's response to interventions and a willingness to adapt the management plan are also critical components of sound professional judgment in emergency obstetric care.